Good morning, everyone. I'm Dr. Melania Battistella from Italy. We are in Fiuggi in my clinic, and we are going to do a treatment with IPL for this patient. Helenia suffers from acne due to a very oily skin and a very high production of fat. And of course, we can see, if we turn the face, that she is affected, especially on the forehead and on the neck, of this kind of disease. The machine that we are going to use today is the IPL from WaveMed. I will show you a little bit the system. We have at our disposal 6 different filters. One that can be used for acne and is 400 up to 1200. The other one is for vascular treatment. We can also treat such kind of vascular disorder, for example, telangiectasia of the face or rosacea, using 2 kind of different filters. One more superficial and one more deep, so we can reach 2 different components into the skin. The first one is the filter 500 to 20 up to 1200, and the other one is 550 up to 1200. Then we can also do treatment for photorejuvenation or for photo damage using the filter 570, and the other option is to do a treatment for epilation in both skin types, the darker one and the wider one. For the wider one, we are going to use the 600 filter, and for the other kind of patient, for example, complex skin, Indian skin, African skin, we have to use the other one, 640. I have already disinfected the skin of the patient that presents this kind of acne with a white point surrounded by redness all around. And I apply a thin layer of the gel. And then we are going to treat her with a special protocol. I'm going to treat her for 5 up to 8 times each 4 days. This is the special protocol for the treatment of acne. The physiological mechanism behind it is just killing the bacteria that provoke the acne. So immediately after the treatment, when we remove the gel, we can see that the redness disappears and the lesion is a little bit dry. Repeating the protocol for a certain period of time, the patient can get rid of all these lesions on the skin. This is the main screen from which we can select intense pulse light, and this is what we can see. Very important. We have this hole in here where we can just insert the different filters, and the machine immediately recognizes which one it is. So in this case it's for acne vulgaris, and the filter is 400 nanometer. Then we have to select the phototype of the patient. For example, clicking phototype 2, the machine selects for you the right parameter to use and proceed with the treatment. We can have also the option to do a skin test. From here we have a photosensitive cells that putting into the skin. So pressing the button and putting the photosensitive cells in contact with the skin, we can see that the system recognizes which phototype it is. Of course, it's different from area to area. We have, for example, the inguinal area that in other case of treatment is likely a little bit hyperpigmented compared to the ones that we can find on the face or on the whole body. So in our case, we double check the parameter. The fluence is correct, but we have also the option to increase or decrease based on the effect that we know to have once we shoot. We have also the length of the flash and the pause between each flash and the other ones. And in our case, having a white skin type, we use a very low frequency, so 1 pulse, 1 hertz, and 15 joule. So now we are ready to proceed with the treatment. We press this button in here, and the machine is in ready modality, the green one. After that, if we want to release the shot, we have just to put in contact the end piece completely with the skin and release the energy from this bottom and cover the whole surface that we want to treat. We note here that we have two Cello Peltier that are very important to cool the skin and make a more comfortable treatment for the patient. Because of course with the energy we release a big amount of heat and we have to reduce it a little bit to avoid that after the treatment the patient is a little bit erythematous. Okay, now I have to cover the eyes to protect it from the lights. I wear my goggles because the flash reflects all around. And now I start from the left side of the patient. Now we are going to feel a little bit of warmth. I move from the area that I have treated to the following one. With a double shot on the more affected area. Turn a little bit the face. Just help yourself with the movements of the hand to have a comfortable treatment also for you. And now, the other side. Double shot, turn a little bit more the face. As you can see, the movement is very fluent because I applied before the gel. So, as you can see, the redness is disappeared. I will remove now the gel so you can see the final effect. As you can see, the lesions here are a little bit more flat, the redness all around is disappear and they are completely dry. It means that in 2-3 days they're gonna change the aspect, we are gonna shoot again and we will assist at the completely changement of the assessment on the skin of the patient.